Hi there, I'm Sitso Amankwah. I'm one of the GPs from Fort House Surgery. I'm also the lead clinician for ADHD medication monitoring, and I also oversee the shared care agreements at the surgery. So, what I'll bring today is, as long as I can get my mouse to work, going through a presentation on ADHD, ASD, and autism spectrum disorder and right to choose and how the referral process works. So, just a brief summary of what we'll be covering over the next 10 minutes or so. So, when we're talking about ADHD and ASD, these are what we refer to as neurodivergent conditions. So, neurodiversity and neurodivergent sometimes the terms are interchanged incorrectly. Neurodiversity is essentially looking at the whole spectrum of sensory, emotional, and behavioral responses in certain situations. And when it comes to autism and ADHD, those responses can end up being at the extremes of the range. A lot of people recognize their responses aren't falling into the typical range, and as such, they'll try to mask certain behavioral traits, and that actually in itself can end up having a knock on impact when it comes to mental illness as well as exhaustion over a number of years. With regard to ADHD, there's set criteria that you're looking at for diagnosing it as well. The crucial thing I'd probably say from this slide is that you do not need to be hyperactive to be diagnosed with ADHD, and a significant proportion of people actually have the more inattentive variant, which is typically looking at poor concentration, forgetfulness, and also can be reduced energy levels. So it's also worth bearing in mind that the behavior traits need to be inappropriate for your developmental stage. Put in a different way, if you looked at your average 2-year-old, they are going to be more than likely to be hyperactive, impulsive, and not pay attention. Does that mean they have ADHD, or does it mean they're a 2-year-old? Much more likely they're a 2-year-old, but if those traits obviously continue on to the age of 4, 5, 6, that's where we start to consider if they're falling outside of that normal range, and then you're looking at the potential for referral. So, if you are deciding that you want to look at taking things further, what are your options? So, you can broadly break it into the private and NHS routes. And when it comes to NHS referrals for kids, it's either via the school if you want to go with one of the local services in our area, that would be Mindwork Surrey, or if you wanted to look at Right to Choose, those ones have to be done via the GP surgery. From the adult perspective, you've also got private and NHS options. With the NHS ones, we actually do the referrals at the surgery, either to the Surrey and Borders service or to any right to choose providers. Now, the big question lots of people always ask is, how long will I wait to be seen? So, when it comes to the child assessments, looking at about 2.5 years, and that's referrals that were taken from today. So that has come down a bit from where it used to be, but still isn't great. As for the adult service, about the length of a piece of string. So I could not find any reliable data on what the waiting times are here, but there's various quotes where it can be anything between 5 to 8 years, which is obviously a very long time to be waiting for assessment. So with that in mind, we're going to be looking at the right to choose framework and how that works. So right to choose is a relatively new concept when it comes to mental health referrals, but essentially it allows your care to happen in another part of the country through the NHS. The provider you get referred to has to be able to offer the same level of service that you would be getting from your local providers. So in this case, if we're looking at ADHD, for example, they have to be able to use the same diagnostic assessments. They have to be able to make that assessment with a qualified health professional. And if you are diagnosed, and looking at medication, they have to be in a position where they're able to offer the same range of treatments with appropriate supervision. So because these providers are based in different parts of the country, they'll offer remote assessments, i.e. a video call, but they do also, in some cases, offer you the option to still attend for a face-to-face assessment if that's preferred. These assessments, as I mentioned, are carried out by qualified mental health practitioners, and each service will be overseen by at least one mental health consultant. Now, if a diagnosis is confirmed, you're then looking at ongoing treatment and support with that provider. And as with all NHS services, the exact level of support can vary from one to another. So I'd always encourage you to have a look at their websites, and we've got links to those in the comment section so that you can see them at your own leisure. And important point to be aware of is that if you are referred to one particular provider and then you find there's a big shift in waiting times, you can actually request referral to a new provider, and that doesn't it doesn't impact your place in the original queue, but also it means that you're able to get an assessment in a quicker time frame, if that turns out to be the case. So what do we do next from here? So you could look to do a screening questionnaire. These are readily available online. For children, there's one called the SNAP Parent and Teacher Scale. So this is where, as you can guess, parents or teachers fill in the details. It takes 2 to 3 minutes to fill in. Not diagnostic, so if you don't get a very high score on it, it doesn't mean that it's a different diagnosis. We just keep a more open mind when it comes to referral. And you've also got the adult equivalent, which is the Adult Self-Report Scale, ASRS. And then with regard to autism, again, you have a questionnaire known as the Autism Quotient 10 or AQ10. And I should point out these are available in different languages as well. So what to do from here if you wanted to look at taking things further. So I'd always suggest getting in touch with us at the surgery first of all. You can do that through our website, and then in addition you can actually have a look at the ADHD UK website, and it's an excellent resource when it comes to not only information about ADHD and autism. It also has links to all of the available right to choose providers where you can look through their information. It's got further information about what steps to take after a diagnosis, and actually they even have areas to help when it comes to, for example, impacts on education and employment and knowing your various rights. And then from there, if you wanted to look at getting a referral, ideally, if you know who you want to be referred to, that can speed up the process. But if not, we can have a chat about what your options are with the different providers, bearing in mind some of them do have age ranges for the child assessments. And then when it comes to the ADHD referrals, it's also quite helpful to know some physical measurements, i.e. height, weight, blood pressure and pulse. And that's because it can affect potentially which medications would be offered if you wanted to go down that treatment route. So that brings me nicely into the section about treatment. So the general idea behind medications for ADHD is that they work by stimulating parts of the brain that help with concentration and regulating emotions. So the medications can vary according to a lot of factors. There is risk of side effects if the dose is wrong or if the wrong brand is selected. And as such, all medications should always be initiated by a specialist, whether that's private or NHS. But once stabilised, that's where we can come in and take on a shared care agreement. As far as the practice role goes in that, we would accept these agreements once the medication dose has been stabilised for an appropriate period of time. You can then order your prescriptions directly from the practice, with the caveat that you are having ongoing regular reviews, both from a physical and mental health perspective, and that has to include at least a yearly review with your consultant or clinic. So lots of resources, as I've mentioned before, that you can look at. I've already referenced ADHD UK. From an autism perspective, the National Autistic Society can be a really good learning resource. It also has some peer support groups and a helpline available, as do Mindwork Surrey, and you don't need a diagnosis to access their out of hours advice line. Forgive me, I forgot to put the hours on there, but it's open from 5 till 11 p.m. Monday through Saturday. And the Surrey and Borders Partnership also have some links on their website for different support resources when it comes to ADHD, especially post-diagnosis, if you wanted to look at some further therapies. So thank you very much for taking the time to listen to the presentation. I hope that has been of some use. We'll be uploading more posts as part of our Neurodiversity Awareness Week. And as I mentioned, you can also look in the comment section if you want links to any of the websites mentioned in this presentation. But as always, if you've got any burning questions, please get in touch with us at the surgery. We'll do what we can to help. All the best. Take care.